Good afternoon. I'm Catherine Santoro, Director of Programming at the National Institute for Healthcare Management Foundation. On behalf of NIHCM, welcome to our webinar today. Today's webinar is the first segment in a four-part series exploring innovative strategies and evidence-based solutions to defy depths of despair and lift our society from crisis. We're seeing this crisis manifest in rising rates of substance abuse, depression, and suicide across the United States. Just last week, the CDC reported new data on the opioid epidemic's third wave, rising rates of overdose deaths from fentanyl. The latest World Happiness Report, also released last week, indicated that happiness among adult Americans has been on the decline since 2000, largely due to an epidemic of addictions that contribute to unhappiness and depression. In future webinars, we'll explore trends in mental health, suicide, and substance abuse in more detail. Today, we're starting our series by focusing on ways to increase happiness and well-being and learning more about the science linking happiness to health. We're pleased to have a truly inspiring panel of experts with us today to explore why and how leaders in healthcare and business are investing in well-being. Before we hear from them, I'd like to thank NIHCM's President and CEO, Nancy Chalkley, and the NIHCM team who helped to convene this event today, including Kate Ellis, Caitlin Smith, Alexis Wing, and Kirsten Wade. On our website, you can find biographical information for our speakers, along with the agenda and copies of slides. We also invite you to live tweet during the webinar using the hashtag #DefyingDespair. Unfortunately, one of our speakers is running behind, and we're hoping she joins us late, so we're going to switch our agenda order a little bit and start today with LuAnn Heinen, who's really been at the forefront as employers have moved from traditional workplace wellness programs to investing in well-being, with the goal of improving happiness, health, and productivity. LuAnn is Vice President of Wellbeing and Workforce Strategy at the National Business Group on Health. She leads their initiatives on employee, family, and community well-being and workforce effectiveness. LuAnn?
Thank you, Catherine. Thank you so much to NIHCM and my fellow panelists and the audience today for this opportunity to speak about well-being from the large employer perspective. I'm delighted to be here. I know that, the main event is the science of happiness, and we hope that our researcher will be on next, but we're going to forge ahead and talk about employer practices. So, NBGH, or the Business Group, as we call ourselves, is a nonprofit membership organization. We're located in Washington, D.C., and these are some of our 440 or so current members. And on the left are aspirational goals as an organization. My work especially supports the second and the third of these, why well-being is a good workforce strategy and how it supports health and productivity and performance. So our members, as you can see, are mostly private employers, but we do have in our membership the largest employer of all, the Office of Personnel Management of the federal government. We have the state of Tennessee, and even a county or two. Hennepin County in Minneapolis is a member. So that's the perspective that we represent. However, it's really important that while we keep the large self-insured employer perspective top of mind in all that we do at the Business Group, we very much need and welcome other stakeholders, especially health plans, health systems, and all the other partners to the employer community, and these are our members as well. Now, if this headline were true, we could declare victory and go home. We know it's probably not true, especially if you were to ask employees. I left it on here because it's just a lesson as we prepare our survey reports, and this is from a survey that we've done of large employers in partnership with Fidelity. And this is the heading, well-being nearly universal, which it struck me as funny. I thought, you know what? I put it in quotes, and we'll remember to do a better job next time we write the report. It's due for an update, because what we do know and what this means to say is that when you survey the heads of benefits, the heads of total rewards, people who are leading wellness or well-being at these large companies, a very large majority of them say well-being is part of their company's overall business strategy. It's integral to their strategy at 92%, and that's gone up year over year. Now, a quarter of them also say that they tie well-being to at least one key business metric in their organization. And it's not in this set of survey data, but we know from other work that those metrics, those business performance metrics, are things like talent attraction, improved customer satisfaction, better employee engagement scores, less shrinkage, that's retail speak for employee theft, fewer incidental or unplanned absences, and any number of other industry-specific metrics. So we're going to be trying to make the case today that well-being is part of workforce strategy, is and should be. Just a little bit about semantics. We have undergone, over the last 5 years, a shift to this broader view of well-being. We at the business group use the term well-being to describe this multidimensional approach encompassing the kinds of these sort of pillars of well-being that you see here. Some people still use the term wellness, and they mean exactly the same thing. So you need to be clear. You know, well-being sometimes looks more like a traditional wellness program. Wellness could be, you know, addressing all these dimensions of well-being. So you need to dig a little deeper and understand what the terminology is that's being used. So this has been a big push the last several years. And I want to just show you a little bit about the common elements of physical health programming at the workplace. So, and what's in boxes is, you know, these are things that seem to be trending and things we want to watch going forward. This is mostly not that new or novel. These are the kinds of physical health supports that large employers and all employers have been providing to some degree for a long time. It's not all inclusive, you know, remember this is survey data, so it captures the responses to what was asked. So notably missing, because we didn't ask about it, would be things like environmental interventions and nudges, you know, walking clubs, open stairwells, lots of other things that many employers do. Moving to emotional health, this is an area of great focus. You know, depression, anxiety, opioids, lots of reasons why there's an important focus on emotional and mental health and well-being. Happiness initiatives do exist. They're getting some traction. This survey shows 29% of large employers surveyed said they had happiness initiatives in place in 2018, and another 25% are considering for 2019. Now, the kinds of programs, you know, there's a lot of variability included, you know, behind these data. So I'll just give you one example of something that I happened to visit not too long ago. So at General Mills headquarters, they have something called a Zenergy room, for example, and it's located in the on-site clinic. So you make an appointment, you book the room, and you can go in, and it's a guided sort of relaxation opportunity in a quiet room. So you've got like an iPad that you can look at and see sort of, it's a progressive relaxation exercise, and if you make it all the way to the end, there's, you know, little beautiful birds that are twittering, and you hear the music and you see the birds, and employees have really resonated to that. So it can be just a quiet space like that, or you know, there are simple dial-in, you know, dial M for Om or other kinds of guided meditations people can do from their desk. So at the business group, we have brought forth resources to the membership on happiness over the last few years, and this is just an example. It's a piece of an infographic to try to, you know, explain, educate, make aware why positive emotions are good for employees and the bottom line. And the next part of that infographic, can't fit it all on a slide, is here. And basically it's what are strategies for cultivating positive emotions. I will say if any of you on the line have audiences and you're interested in happiness, one of the most successful webinars we ever had, and the business group doesn't draw quite the audience that NIHCM does, but it still, I think, holds the record for most people dialed in for it. It was a Danish happiness expert, an unpronounceable last name, Alexander Krolf, I think it is. His company is Woohoo Inc. He's written books on happiness, and we had him speak, I think 2015, which is the year that Denmark was at the top of the charts in the World Happiness Index. And I can tell you this is something that resonates with people personally as well as professionally. So back to our dimensions of holistic well-being, community involvement is something that's important to all employees. It's often stated, millennials are interested in volunteering, but we find that it's meaningful to all generations in the workplace. Employees want to be connected to their community and to do good, and they value their employer's community involvement as well. So team-building volunteer programs are really popular. There are more organizations even giving time off to volunteer. So financial security is a key dimension of well-being. Some folks call it financial wellness or financial well-being, but it's really about security. It's knowing that you have the resources to pay your bills, you have the money to do what you want, and not worry. Companies have recognized in our membership, this is the private sector, and I think this one really hits home with them because on recognizing that there's a hierarchy of needs, financial stress is bad for health, bad for work engagement, and for most people, financial security is a higher priority, or financial worries are what they care about more than signing up for a weight loss program or a wellness challenge at work. And also, I think that if you're looking at the kinds of companies we have in our membership, I think that it hits them hard because this is something that we should help with. I mean, no, this is closer to our business and closer to our skill set than, let's say, managing healthcare even. I mean, this is something that I think companies are really moved ahead on, recognizing the problems that we have in this country with people, even employed people, not being able to pay bills, not having cash reserves. So it's something they're going after in a big way. Student loan counseling and repayment assistance is on the rise, but there are many other programs that are addressing all different types of employees at different income levels. So paid leave. There's been something of an arms race, again, in many companies for, somebody comes out with 16 weeks of parental leave, someone comes out with, 24 weeks of parental leave. It's been a little bit of, like I say, something of an arms race, and it's discussed everywhere. It's important. It's very much related to well-being and financial security. And it's also part of the employment value proposition today. So leave and flexibilities at work are factors in the competition to attract and retain talent generally, and again, certainly in a competitive labor market as we have now. We're also hearing more about caregiving. It's related to leave. Our employer members over the last couple of years have been more and more concerned about the impact of caregiving, and of course their employees, many of them are in the sandwich generation, and more companies are now beginning to address this issue. Rosalind Carter's quote, my slide's very small, but perhaps you can see her quote here. There are only 4 kinds of people in the world: those who have been caregivers, who currently are caregivers, who will be, and who will need caregivers. And that resonates now more than ever. And while paid leave is a growing priority and it certainly helps in caregiving, it's important to note that leave alone won't solve for this challenge. The course of chronic illness and aging is, something that most employers, can't give enough leave to address the problem. So in addition to working with existing community-based organizations, there are startups and other organizations who are offering extremely useful services that employers can offer free to their employees or at a subsidized rate or even just as a referral. And these are services that hire aides, perhaps, can identify assisted living, provide navigator and concierge services for families with chronically ill parents, grandparents, and children. And it's a trend, another trend we're seeing. And coming full circle, why is it that well-being matters for employers and employees and makes sense as a workforce strategy? Well, there is research to support all of the statements on this slide, and much of this research, virtually all of it, comes from Gallup. It's done on their well-being index, and it was originally the Gallup Healthways shared research agenda. It's now Gallup ShareCare that's produced a lot of this data. We know that well-being, holistically defined, is a much better predictor of work performance than physical health. So those who are thriving physically but not thriving in all domains of well-being are more likely to miss work, file a workers' comp claim, look for a new job or change employers, and they're less resilient and less equipped to deal with setbacks. So higher well-being impacts business in terms of lowered healthcare costs, more appropriate use of the ER, fewer hospital admissions, lower rates of absence and disability, reduced presenteeism, which is when you're on the job but not really all there because you're thinking about your health problem or loved ones, increased retention, better job performance, and there's data from performance reviews that supports this. And then the other kicker, sort of the amplifier, is that higher overall well-being augments the benefits of engagement. So there's data that shows work units do better with high employee engagement levels, and they do even better when there are high well-being scores as well. So thank you so much for your attention, and I look forward to having a dialogue at the end of the call.
Thank you so much, LuAnn. It was really clear from your presentation that employers are recognizing the benefits of creating this culture that prioritizes well-being, and they're also really forward-thinking about evolving their benefit strategies and things that have an impact on well-being, such as the paid family leave that you discussed. Our next speaker, Cindy Bjorkquist, will share how health plans are developing cutting-edge programs to easily reach people with tools and information to increase their well-being. Recognizing the health and productivity benefits of well-being, Blue Cross Blue Shield of Michigan rolled out a first-of-its-kind virtual well-being benefit for employers and members at the beginning of 2019. Cindy is the Director of Health and Well-Being at Blue Cross Blue Shield of Michigan. She developed this program and is leading its implementation, and we're so pleased she's here with us today. Cindy?
Thank you. On behalf of Blue Cross Blue Shield of Michigan, I want to thank you for the time, and we certainly appreciate the opportunity to review with you just one of our new innovative programs that launched this year, termed and called Virtual Wellbeing. In the time we have today, I want to briefly touch on the background of why we developed virtual well-being and then do a brief overview. We believe at Blue Cross Blue Shield of Michigan that healthcare is personal for our members. We provide smarter, better healthcare for over 5 million people. That means it should be comprehensive, cohesive, and tailored to what each member needs. Those needs are not limited to just medical care, as we discussed, but they extend to social, emotional, community, and even financial factors, as LuAnn referenced. Our focus is on whole person health, or the member's state of well-being. as a health plan, we partner strategically with employers and try to really understand what they need. And we know they need better managed costs, healthier employees, and a positive member experience. That way we deliver on those needs through our tailored network solutions, improved care in every community. In fact, 20% of our membership actually live outside of the state of Michigan, as well as personalized engagement. Positioned in how we improve care within that smarter, better healthcare model is our integrated portfolio of health and well-being programs. The vision and goal of these programs is to support our members on their personal journey through life. We believe everyone brings their own story to that journey, which results in their current state of health and well-being. Our programs support those members wherever they are on that journey, taking into consideration their physical, financial, social, community, and emotional health. As LuAnn mentioned, the industry continues to both define well-being and try to capture the total value of all the various programs and components of well-being models that make a person healthier and more resilient in their life. And because of this, we spent time actually daily combing through the research and taking advantage of really the explosion of publications and articles on well-being and the topics associated with well-being to bring our members and our employers the most up-to-date programs on well-being. You know, well-being has gained a lot of traction, and you hear about it in the news every day for the past, I would say, 5 to 10 years, but that's primarily due, we believe, to national attention and supporting body of evidence leveraged from neuroscience. One aspect of well-being that may be unique to our model is that we feel very strongly about always including in our development cycle the added measure of people having a perception of how their life is going. And that's at any given time, and how important that perception is to our members' overall state of health and well-being, and really on a daily basis. Whether their life is fulfilling to them and satisfying, whether they feel their best every single day, and where they feel their life is headed in the future. Supporting our members in this whole health view and their personal journey, and adding the importance of this perception of life, if you will, on a daily basis, all of these things were the main reasons we decided to develop virtual well-being. We needed the ability to engage our employers and support them in programming for their employees, to educate and inspire our members on all aspects of well-being, and we wanted to do this on a weekly basis, nationwide, and 24 hours a day. Surveys consistently report employers are increasingly interested in offering health and well-being programs to their employees now and in the future. And in fact, one of LuAnn's quotes that I picked up on were 92% of employers consider well-being part of their overall business strategy, and that's up from 86%. So it's spot on with what we found in the research as well. Employers understand the value of a strong culture of well-being and how it can affect their employees. And in fact, when I looked at a worldwide Gallup consulting survey, it actually reported 60% of those surveyed said their employer negatively impacts their well-being. Employers don't want that. They want thriving employees who take significantly fewer sick days, cost less in lost productivity, are much more likely to be engaged in their workplace, and in help improve their communities and the brands of the organizations that employ them. With limited resources to develop and administer these programs, supporting our employers was a strong focus for us for this program. We already offered a full set of employer and member-facing health and well-being programs delivered through digital, telephonic, and on-site. But we wanted to offer a program that would engage people in a new and innovative way and be scalable, since we support so many employers and over 5 million members. In fact, on the CBS News this morning, they had an employer on there that said a quote directly in line with what we're talking about today, and she said, "A leader is a good leader if they have employees who know they care about their performance, but also they care about their overall well-being." So So this brought us to developing a program we would deliver virtually, and we branded the program Virtual Wellbeing. Using a virtual format allowed us to be scalable, deliver separate sessions for members and employers, and deliver content using webinar capabilities using PowerPoint and graphics. The intent was always to host the sessions live with audio and video as opposed to a podcast or audio webinar because we wanted to keep the personal relationship and connection to the host. Many of these topics with well-being are very personal and require the participants to really assess their journey, so this was an important capability that we wanted to offer. We wanted to replicate what we had successfully been administering on-site using on-site well-being coordinators in a separate program. Virtual Wellbeing offers 2 live webinars each week hosted by a virtual coordinator, one for employers on Tuesdays and one for members on Thursdays. Employer webinars focus on well-being topics with content that can be downloaded and used to help deliver, develop, and enhance worksite wellness programs. The member webinars mirror the employer topics, and they include all the financial, emotional health, exercise, nutrition, meditation, social isolation, among more. And the feature of being a live webinar gave the program the opportunity to have participants chat or send questions during the webinar session to that coordinator. The questions are answered at the end of the webinar or answered after the close of the session. Surveys are used at the end of webinars to capture feedback, monitor quality, and measure value of the program from the perspective of both the employers and the members. All webinars are accessible in a responsive design environment for all devices. To make the registration process as easy as possible, we designed a landing page split by employer and member sections with associated links. The links open up to register for upcoming webinars, register and watch archived webinars in a past webinars tab, and download webinar content on demand to be used either personally if they're a member or pushed out to employees if they are an employer. The downloadable content includes PowerPoint slides from the webinar, associated handouts, and an email template with text that can be tailored and sent to their employees if they are an employer relating the weekly topic. Or we hear from our members that they're sending content and these slides to their family and friends or storing for later reference. Every detail of how to engage participants was thought out, and you may think this is funny, but even the backdrop that would be used, we initially shot the backdrop with your typical plant and bookcase in the back. But as an exercise physiologist, I really believe wholeheartedly in the research that states if you spend 90 minutes of your day outside in a wooded area, there will be a decrease in activity in the part of the brain typically associated with depression. So spending time in nature, as we all know, not only reduces blood pressure, anxiety, and increasing happiness, which we'll talk about later, but it also reduces aggression, improves pain control, it improves your immune system with a whole host of other benefits. So I wanted the backdrop to reflect a variety of outdoor calming scenes where people would connect with nature each week from their desk or wherever they were watching from their mobile phone. So my hope is that it would encourage them to try and get more outdoor activity in their lives. And each week participants view either a rotating backdrop of nature scenes of trees in a forest, there's a path through a park, there's a mountain with a calming water in front of it that you can see on your left, or you can be on a beach, which is the middle scene as well. I cannot say enough about the person we chose to lead the webinar. Matt was one of our on-site well-being coordinators in a separate program, and we are so fortunate that he agreed to be our virtual well-being coordinator. We knew we needed someone who could relate to people, someone who was comfortable in front of a camera, really without that face-to-face interaction, which is really difficult to do on a weekly basis. The way he delivers the content with audio and video, you feel as though he is speaking directly to you. His passion for this field of study was very apparent when he's doing these webinars to both the participants, and his extensive knowledge and communication skills were really a huge bonus for the program as we went through the development of virtual well-being. We encourage Matt to use real-life examples wherever he can and really connect and inspire those participating. So he's pictured here with his wife Jenna and their dog Sky, and we really felt that he needed to have his personality come through and really come across as real and authentic and a person guiding them through this knowledge. And this was actually the case that happened on his very first webinar in January. We had a small glitch for a couple of minutes only on the audio, and it didn't work. And he laughed it off and mentioned, once he did have the audio work, how life doesn't always go as planned, and that you can really train your mind to be resilient to the challenges in life. And he's used that example actually since January, and it was the perfect way to introduce Matt to the audience. As people dial into the webinars, if they dial in before the start time of noon, they'll hear birds chirping, ocean waves, or rain, along with inspirational quotes displayed on the screen that are associated with the topic of the week. When the webinar starts at noon, Matt does a quick tip or a mindful moment related to the topic of the week. And the week that focused on kindness as an example, Matt began with a quick tip on random acts of kindness, giving participants ideas that they could implement throughout the week. Depending on the topic of the week, Matt may choose to use a mindful moment instead of a quick tip at the beginning of the webinar. An example would be the week he covered mindful breathing. He gave opportunities of when and where participants could practice this. Taking breaths on the way to meetings, in the elevator, when you get to a workstation, in the morning before the day starts, or after lunch, on a walk to a building from your car, or when you get overwhelmed to reinforce your mind and your body. We wanted people in this program to walk away with ideas that they could use that day. We developed all of the webinars and content internally using a staff person who leads our research, receiving alerts daily on various well-being topics, articles linked to new research or supporting research, news organizations, information posted on message boards, universities, and scholarly journals. She sends summarized research to both Matt, that coordinator, virtually, and then also the coordinators that we have working on site at employers who actually purchase our premium program. She incorporates the new information weekly into the scripting of the associated virtual well-being webinars so we can keep those scripts up to date. There are currently 52 weeks of topics, so the list isn't all represented here on the next couple of slides, but I want to share the range of topics that we offer. Those webinars are built around well-being topics which apply, and this is kind of important to us, to all of our members across all of our segments, and that does include our commercial market, our seniors, college-age individuals, and our individual market. The topics range from social connectedness, sense of purpose, finance, physical, but extend into techniques that increase well-being, such as our newest webinar on cleaning up your clutter and digital detox. We have developed webinars on rewiring the brain towards happiness, gratitude, resilience, kindness, compassion, and even delivered a webinar on how to encourage your leadership to embrace well-being programming. Some webinars include areas that we decide needed a subject matter expert, so Matt is joined by a co-host on that week who is an expert within that field. And these topics would include examples like behavioral health, pharmacy, financial, nutrition, diabetes, proper usage of care, senior care management, or even on-site well-being coordinators. Letting our members know how to rewire their brain towards kindness, happiness, and compassion, among other well-being traits, was a major part of the program development. The associated research is quoted and given at every week example, and then all these examples are given on how they can apply to their daily life. The real only thing that these members have to do is they have to decide to engage in that practice. And hopefully coming back week after week and giving them this information, they'll go ahead and make that decision on some of these well-being topics. This is actually a slide, and Matt is shown here on the left, and we will supply you with links to our landing page where you can actually go in and watch these webinars and see how this whole program works. This is what the session actually looks like to a person once Matt comes on after that mindful moment. And we tried to do a really good job of pulling graphics and getting graphics to try to engage people as well into the slides. We kept the webinars very short. We did a lot of focus groups, and we talked to a lot of members. In fact, I still have my staff to this day remind me that I was on my bike one time last summer riding around a lake, and I stopped and talked to every individual I came across within a 2-hour span of time, told them what we were doing and got their feedback, and I heard from every single person they wanted a very short webinar that they could dial into and listen to. So we capped the length of the webinars from 13 to 15 minutes long to give people that opportunity, and then it's followed by a survey and a question and answer session. The marketing and promotion to both the employers and the members is an ongoing effort for us at Blue Cross. We continue to partner with multiple stakeholders to drive engagement. We have internal sales marketing with monthly updates, emails to members quarterly, we have group emails monthly, promotional advertisement in our chamber directories, links on chamber websites, postcards from members distributed at health fairs, open enrollments. I talk at conferences. We have a lot of blogs that we publish mentioning this. We have member flyers, quarterly calendars. One of the most important things that we're doing is messages are posted on every EOB that members receive, and then also IVR messages that will be implemented within our customer service area. We have provider messaging and the role that we have providers in this model, and articles within our hospital and physician updates, and we've got the Record, which is a newsletter for our physicians that we promote virtual well-being in. We created a member toolkit with web banners, social media message, emails, and newsletter articles, all to help employers who are promoting this program to their employees, because that's kind of how we want this to work. We want the employers to watch on Tuesdays and then refer their employees to that Thursday member webinar as well. We try to think out of the box a little bit with promotion. I even had the opportunity to do a promotional interview at the 2018 Iceman Cometh bike race here in Michigan. For any of you that know about that bike race, it's actually up north, and there were about 10,000 people in the middle of the woods in sub-zero weather, and I had both hand warmers and feet warmers on for that interview, but it gave us the opportunity again to try to tell members about the virtual well-being program. As you're probably aware, well-being is enhanced with mindfulness and meditation, and there's a growing body of research supporting this. So we have been leading meditation sessions for years at that worksite program that I mentioned earlier, and they were very successful, and both employees and executives who attend really enjoyed them. So in February, 1 month into the program after we launched, we enhanced the virtual well-being with meditation sessions on Wednesdays to replicate that program that we were doing with those on-site coordinators for a couple of years. There's thousands of studies that have been conducted to determine the benefits of meditation, and we know and believe that brains of people who meditate are just structurally different from those who don't meditate. You know, you can control your impulses, you can maintain your attention, which is very important for those employers to relay that information to their employees. You have improved body awareness, which will help on the physical side, enhanced focus, stress management, and attention control. And that we also know with regular meditation, it was found that the brain region linked with processing sadness, anxiety, and other negative emotions actually shrinks in size. So we understand that there are many, and believe there are many types of meditation out there, so that gave us the opportunity to expose our members to all the various ways that they could use meditation themselves. We really wanted them to understand that it didn't have to be the traditional meditation they may believe you have to do, which is in the back of a dark yoga class, sitting cross-legged with your fingers out in the air, that you can meditate while you're walking. You can meditate in an elevator to a meeting. I meditate when I walk my dog. We wanted to relay this information and the importance of meditation, as well as give them information so they could choose to make that decision. The feedback has been amazing in the short, almost 4 months the program has been live. I added a couple of direct quotes from our surveys, both from the member and employer webinars on the slide here. The best one for me personally was when I read one of the members sent in to Matt, "I am so excited about this and ready for this journey." That was the goal of the program from the beginning, and we look forward to continuing virtual well-being and helping impact the lives of our 5 million members and supporting them on their journey of well-being and improving their state of well-being. And that's all I have, so I'm looking forward to the question and answer series.
Thank you, Cindy, for your leadership on this unique program. Your passion really shines through when you're speaking about it, and we look forward to hearing more about its impact in the months and years ahead. We're going to borrow Matt's quote that life doesn't always go as planned, and unfortunately, Emiliana is unable to be with us today, but we will work to make her presentation available. In the meantime, you can view her slides on our website, and at the end of her slides, she has a few links to some of her courses on happiness. At this time, I'd like to open up our Q&A session. You can continue to submit questions in the Q&A box. I wanted to start with a question for LuAnn and Cindy that, there's been previous research about a lack of ROI or healthcare cost reduction for traditional wellness programs, especially HRAs and preventive coaching. Do you have any data yet, or do you know how employers or how with the program in Michigan that you're planning to measure the short-term outcomes of the efforts or eventually demonstrate an ROI for these types of emerging well-being programs?
Yeah, it's easier within a program that is not offered to 5 million members and the vast amount of employers that are dialing in to measure an ROI, as you know. Well-being in itself is such a broad model that to nail down a randomized controlled trial on it is pretty difficult as well. The controlling trends of the research today in ROI that's applied to wellness programs pretty much stand firm for well-being. But I think from our perspective, because the well-being model is such a large model that encapsulates neuroscience and the brain, and I talked about sense of purpose and how a person feels about themselves, that you do err over on the side of behavioral health. And so even with a broader model with well-being, capturing that ROI is very difficult. What we do know and what makes sense and what we've heard in business cases and seen in research for the 35 years I've been in the industry is the assumption leap that if you have a program that helps a person become healthier, then you know that they're probably going to be a healthier person who will trend less on claims costs. From our perspective, it's that behavioral health element that you add to that as well. Now, the traditional wellness programs will look at traction and retention of great valued employees. We know that the employers that we talk to that are trying to hire millennials, valued millennials, that they're all too often looking at employers who actually have well-being programs as well. So there's a vast amount of data out there that could lead you to the assumption that a well-being program that encapsulates all of those components, that there will be a positive ROI on that.
Hi, it's LuAnn. I can speak to that as well. And we prefer not to use ROI. We know some CFOs, financial people will ask for it, but ROI by definition means the costs and the benefits all translate into dollars, and you can come up with a nice ratio, what the return on investment is. And that's just really tough to do, as Cindy just said. So what we suggest is the frame of a value of the investment, and where value allows you to capture some of the non-financial, non-quantifiable benefits, things that, so short-term surveys even, one of the things, I talked about the Danish happiness guy, one of the things he told us, and we're actually doing it in our organization, is we've got 2 buckets of tennis balls right by the bathroom, and and there's a chalkboard in between. And the chalkboard says, or you actually take a tennis ball and you throw it in either the basket. Are you having a good day? Yes or no. And you can get kind of pulse survey information on how people are doing. And you can kind of correlate that with things that are going on in the office. It's a source of information. So you need data and you need a story to make the case. And the data, you take the data that you have, and you create a story. There's a story in terms of what do we think we're trying to achieve here that's important for our business goals. And if you have data and a story that really support each other, and you have, your audience more likely than not is going to buy that.
Mm-hmm. Great. A follow-up question for both of you. Can you speak to the role of employees in articulating the need for creating and refining well-being programs and defining the value once they're deployed? I know, Cindy, you had, some feedback from people that have already experienced your program.
Yeah, again, I go back to both. We have that member webinar. We've got surveys at the end of each webinar, so we're hearing back at a very high satisfaction rate, actually in the high 90s of satisfaction with the people on the webinar. We've done this, I think from our perspective, we've done this on site for years, and we're trying to deploy and support those employers that want to do this. And the value of the well-being programs from a member's perspective, that's what we're trying to capture with those surveys that we send out. I think even more than the surveys are the comments that we get back after every weekly session of people making comments of how impactful that these sessions are to not only increasing their awareness, but also educating them on how to make movement on that as well.
Great. A follow-up question for you, Cindy. You mentioned making some of the videos available. Could you talk about, how accessible the program is to the public? Is it just for your members, or can you access some of the information?
Yeah, it's on a landing page, and we'll send a link out. And that landing page, again, the decision to make it on its separate landing page was so it would be easily accessible to register for those webinars, and so it is accessible to the public.
Great, thank you. LuAnn, one clarifying question about the source for the percentage of companies offering parental leave that was in one of your last slides. And then Can you also kind of expand on how, there's been, as you mentioned, there's been a lot in the news lately about paid family leave. And can you talk a little bit about sort of the benefits or challenges of policy change and how that'll impact employers going forward?
Sure. So the source for that is what we call a quick survey. It's of our the business group, National Business Group on Health membership. The number of respondents was in the 65 companies. So, it's not showing up in a peer-reviewed journal, but our membership is 75% of the Fortune 100, and a high percentage of the Fortune 500. So those kinds of companies, a large percentage offer family leave. let's see. I think that, well, one of the really interesting discussions to your question, Catherine, is, the Gates Foundation. I don't know how many people followed the story of the Gates Foundation, which had, gone to the extreme of giving a year of leave for a new baby, a year of paid leave, and that they rolled that back with, got lots of attention in the press. The CHRO said that they'd found that was too long and it was somewhat disruptive to the foundation's business. And so they've settled on 6 months leave as closer to optimal. And to sort of sweeten that rollback, they provided a $20,000 stipend for families, which, most people would jump up and down and cheer if that were available to them through their employer. That's extremely unusual. The Gates Foundation, they're not a member of ours, but that's, I think that taken too far, there is a disruption to workflow, and the onboarding, coming back to work gets more difficult maybe after 6 months. We've also heard from some of our large employers that it's really important to think about the well-being of team members who are left behind, who aren't on leave, and that there's an impact there as well. And so it's a balancing act.
Thank you. 2 questions. One, LuAnn, maybe you could start with this. Is sort of, does the business group and do employers sort of have a go-to definition of well-being? How is this really universally understood at this point, since it is more of an emergence and, changing from the workplace wellness to well-being, and how are employers kind of deciding what components to include, like financial literacy and happiness programs?
No, that's a great question. Yeah, it's a little bit in flux. Yeah, it's a little in flux. So at the business group, we did our own, about 5 years ago, deep dive in the research, kind of like what Cindy and her organization did to figure out what our point of view would be on this. And we came up with, we were influenced by Gallup. Ours looks a little bit different. We have financial well-being, social connection, physical, job or career satisfaction, and emotional well-being. So it's 5 pillars. And I say that's, not everyone includes job satisfaction. Some people may include purpose or community. But I think that there's probably 6 dimensions, and most organizations are using, 3 to 5.
Mm-hmm. Yeah, I tend to agree too. And in fact, I was in a large employer discussing well-being with them last week, and LuAnn, they actually had 10 sections of their well-being program. So, and as I stated, we did about a year's research into well-being, and well-being for us is not a new term. I mean, it really goes back into the archives of research where people mind, body, and spirit, and it's even have some biblical references with meditation and prayer. So what we try to do in our model is not be so rigid to say it involves 3 or 5. We, as LuAnn did, part of our research was a lot of Gallup research, but beyond that, we really dove into all the different things that our members would be struggling with. And from a health plan perspective, we knew that sense of community and sense of purpose and financial and all the different things beyond what we were currently doing a couple years ago, physical, and then really diving into that perception of your life. And happiness, I was looking forward to that presentation, because the happiness and the classes and the webinars that we do around that are so important, because we really feel that whatever well-being model you go with and whatever component you add into that well-being model, that this idea that if you wake up in the morning and you are not a person who thinks happy thoughts, or their brain is not wired, if you will, or your default setting of your brain is not wired to happiness, that we believe the research shows that you can change that. And so that was really important for us to communicate to our members, and not only help them understand that the minute their feet hits the floor, they would have the opportunity to do things like journaling and rewiring your brain towards happiness or empathy or compassion, and how you go out and help other people in the community and how that improves your state of well-being. All those things are things that we came up with, which is why we thought that we really needed that weekly webinar session to translate that information to them. And if something pops up, and I mentioned that we have a calendar quarterly that we publish, if something pops up and our researcher actually finds a university or a research model out there that adds another dimension to that, then we will research that and then form a webinar around that as well. So I would say if you ask me today to define the things that we put into a well-being model, that I would have to say there's some rigid 5 or 6 things, but we're trying to apply that to life, and applying those things to life gives you all the other dimensions that you have to actually look at.
Yeah, I would that resonates with me, but I'd also like to add one of the things that we're noticing needs to be incorporated into kind of the well-being perspective is social determinants, and the fact that communities are really, I think, it's becoming increasingly important. Not only that people like where they live, they feel safe, they take pride in their community, yeah, which is part of the Gallup Wellbeing Survey, but also, that companies are doing more to support some of the upstream causes that are hurting well-being in their employee population, for their customers, and in their communities. That's something that...
Yeah, absolutely. And in fact, to show you the connection between exactly what you just stated, as a person who tries to figure out what our well-being portfolio has in it, I'm actually sitting on a work group that is looking at a Detroit neighborhood to figure out how you could improve the health and well-being of the residents in that pocket neighborhood. And that really goes back to exactly what you just stated, that if you take, I saw a Fast Company video one time on this whole subject where, you go into Africa and you look at them and their community, they might have a completely different definition of well-being that somebody sitting in Michigan or sitting in Ohio or Indiana, it's just completely different. And so that model of applying that to not only community, meaning the Gallup sense of if you go into your community and you feel connected in your community, that you have a higher state of well-being, but then trying to define well-being in a certain community or a pocket community with those social determinants of health as well. Absolutely agree.
Great, thank you. I think Emiliana is with us now. Are you there, Emiliana?
Embarrassment. I had not intended to call in at this point in the program. Of course, I had every intention of calling in and offering my presentation at the right time. So I beg your forgiveness.
That's okay. Cindy shared a quote from their well-being program that life doesn't always go as planned, but we still have time, and we've had a few questions from people kind of asking for sort of, strategies that they can translate into their workplace and daily lives, so that it could be a good segue for you to take us through your presentation.
Sure. If there's the time, I would be so grateful to have that opportunity. Let's see. I need to also log into the platform. Is that correct?
Yeah.
So that I can see my slides.
Yeah.
Great. Gosh.
While you're doing that, I'll just give a quick introduction to everyone that Emiliana is the Science Director of the Greater Good Science Center at UC Berkeley and co-instructor of its popular Science of Happiness online course. This fascinating course was profiled last year in U.S. News and World Report in an article, Can You Teach Happiness? And we're grateful that she's able to be here today to teach us all a little bit more about the science of happiness.
Yes, I'm here. I'm open. And is this is this me being on the phone the best way for me to speak to the audience?
Yes. Yep. Everyone can hear you now.
Terrific. Okay, well, thank you for that introduction and for your extraordinary patience and willingness to accommodate my misunderstanding of time. All right, so let's talk about what happiness means. There are a couple different ways that researchers and people themselves think about happiness. One of them we call evaluative, and this is essentially how we think about our lives and how we think about ourselves on a kind of more dispositional or personality level. So am I a kind person? Am I generally enthusiastic or cheerful? This is sort of how we think about ourselves. And the other is experiential, and this is how we feel day in and day out, and particularly the kinds of emotions that we experience that are usually short-lived, and their response to specific experiences or contexts. And the important thing to take into mind from this slide about happiness is that both of these are an important part of what it means to be a happy person. And the mistake that many can make when they don't have the kinds of information that we've been talking about today with you is to prioritize one of them in the absence of the other. So if you imagine, well, I'm going to be happy by trying to feel pleasure and gratify my desires and be enthusiastic and cheerful all the time as a reflection of how I feel, this actually gets in the way of your capacity for being happy. And if you think your way to happiness and think, well, I'm just going to work hard all day long, every moment, and feel miserable for a variety of reasons, stressed, anxious, frustrated, but I just believe in my mind that I'm working towards happiness. That also doesn't work. Both of them together are an important part of what it means to be happy. When we talk about where happiness comes from, what the kind of origins of happiness are, there's a long tradition in this thinking space. Happiness is in some regard been thought of as a reflection of kind of what the stars offer, right? Your astrological fortune. Happy as a word actually shares its roots with the idea of luck, and you see this in words like happenstance or perhaps. Today, the extent to which luck is probably playing a role in happiness is more about kind of your genetic endowment, or perhaps even you could imagine your lived experiences where you don't have much control over how those go early in your life. Virtue is kind of the Greeks and Romans decided, well, even if you're being stretched on the torture rack, if you're living a life that is of virtue, then you're a happy person. While today's thinking really reflects more on ideas of purpose and meaning are actually quite pervasive in the healthcare context. People who work in healthcare professions tend to score quite high on measures of purpose, and that does fuel an advantage for them in the space of happiness also. A third aspect or idea that gets thought of in the science of happiness is hedonism, this idea that pleasure, right, how we get to gratify desires and accumulate resources and moments of joy is really the secret to happiness. And in fact, there is some extent to which enjoying the good moments in life plays a role. Again, it certainly isn't the most promising aspiration that will lead to happiness to try to maximize pleasure all the time. Our physiological systems relate to pleasure in a way that is shifting, and we get used to things that are good, and should we be pursuing happiness through continuous pleasure, we'll end up on what's called the hedonic treadmill, constantly striving for something bigger and better. The last big piece of happiness has to do with how we connect with the people around us and whether we feel socially supported. And it turns out that being very happy really only happens when we do feel like we are part of a meaningful social relationship, be that with a family member or a friend or a community. We need to have someone to rely on and feel like others rely on us in order to realize and experience happiness. So these are big forces that play into how people think about happiness. a recent overview of the relationship between happiness health published by Andrew Steptoe surveys the different factors that contribute to happiness, from genetics to socioeconomic status to stress exposure. And while all these do in different ways contribute to the magnitude of a given person's happiness, they do in different ways and with different weight according to whether we're measuring evaluative or experiential happiness. For example, socioeconomic status plays a bigger role in evaluative happiness than experiential happiness. You may be very successful, highly achieved, and earning quite a bit of money, but on a day-to-day basis, that doesn't mean that you will be feeling or experiencing those genuine positive emotions like love and affection and enthusiasm and pride, etc. So this is just an overview, very recent, of all the factors that contribute to happiness. When we think about variance in happiness, so why is my happiness score different than yours? Sonia Lubomirsky has offered this model, which basically suggests that our genetic endowment seems to explain about half of the difference between my happiness score and the person next to me. Life circumstances, while many think have a lot to do with why my happiness might be different than yours. You know, I was an only child, or I was the one of 7 children and never got any attention, or I didn't have music lessons, or whatever lived experiences we might, you know, complain to our parents about when we try to think about the reasons for our happiness. Those actually end up not being a big explanation or offering a lot of explanatory power to why we're happier or less happier than the person next to us. And this leaves this big chunk of happiness difference between two people being about what they're doing with their time day in and day out. And that's really what we focus on at the Greater Good Science Center. What are the things that people can do day in and day out to really bolster this overarching quality of life that we call happiness, right? The experience of joy or contentment or positive well-being combined with a sense that our life is meaningful. And there you see those experiential and evaluative aspects of happiness represented. And Ed Diener, one of the other pioneers in happiness science, really uses a different term, but we consider it equivalent. He calls it subjective well-being. This is, again, the capacity to experience positive emotions pretty easily, the ability to kind of get through the difficult times, which will result in negative emotions, which are important and matter to happiness, but we don't want them to be overrepresented, super frequent, or last too long. And then again, this cognitive evaluation that life is good. To measure happiness, researchers administer surveys, and here are 3 examples of different survey items that you might see if you were in a study of happiness. And then on the other side of the slide is an app made by my friend and colleague Matt Killingsworth to try to understand in a what we call experience sampling fashion. How are you feeling? What are you doing right now? Are you thinking about what you're doing? And the effort here is to try to understand how daily experiences and activities really relate to those momentary experiences of enjoyment. And what Matt's research study showed was that when people are paying attention to what they're doing, so they're doing, maybe they're house cleaning, maybe they're playing with their children at the park, or maybe they're working at their computer, whatever it is that they're doing, if they are paying attention to what they're doing and not thinking about other things, right, not distracted by something earlier in the day that made them feel unpleasant or something later in the day on their docket that they're not looking forward to, they experience any moment as being more pleasurable. And this is one of the things that is a great focus of the happiness literature, sort of awareness of the present moment. And this does fall into the umbrella of what many call mindfulness or contemplative practice, the quality of being able to be in a moment and notice exactly what's happening in that moment in your own self and in the context around you without kind of biasing it with or contributing to the experience with sort of future ideas or past worries. In our own data set, which we, I'm going to the next slide, just to reflect on a couple other key findings from the research on happiness that use these methods, the survey methods, to understand the relationship between life experiences and happiness. Ed Diener and Marty Seligman published long ago, they're finding that regardless of what's going on in a person's life, they never fall into the very happy bucket unless they have strong social relationships. They have to have someone to rely on. And the health literature sort of echoes this sentiment in its survey of the literature on loneliness, which basically shows that when people are socially isolated or lonely, they are vulnerable to a whole host of physical disease and ailment and psychological states of disease also. And there's these great sort of snippets of insight that compare loneliness to some of the common risk factors or health behaviors that people already understand are really harmful to health and well-being. And it turns out again that, being lonely is equivalent in that regard. In our own data from our Science of Happiness course, we ask people to fill out surveys about how they're doing in terms of their own happiness. We also use a scale to measure well-being. We ask them to rate how similar they feel to others, how stressed they are, how lonely they are. We also ask them to nominate a peer, which is another friend, to remark on that student. And the friends also explain what the nature of their relationship from poor to exceptional. And in the data charts that we're looking at, we don't actually get very many people who nominate a person who then rates the quality of their relationship as poor. So I'm only showing you good, very good, excellent, and exceptional. And the point of this slide is that across two different samples of cumulatively over 3,000 people all around the world, the higher the quality of the relationship as rated by the peer, this is someone not in the course, the higher the well-being score by the student themselves, their own self-reported well-being score. And the point being that social relationships, again, in this sample of our own data, confer an advantage on the student in terms of their happiness, well-being, and lower levels of stress and loneliness. And all of these differences between groups of students are statistically significant. In a second example from our data, we also asked peers to indicate how various emotional qualities to the students. So again, peers are individuals who are not enrolled in our course, but who know the students enrolled in the course. And so we ask peers, like, think back on the last time you interacted with this student. Were they enthusiastic, cheerful, happy? Were they kind, generous, grateful, compassionate? And were they irritated, frustrated, annoyed? And what I've done is taken you through kind of positive qualities, pro-social qualities, and antisocial qualities. And what you see in this chart is that the relationships that are rated as exceptional by the peers are the same relationships with students who score high on pro-social qualities. So it's not so much that we like other people who are cheerful and enthusiastic and sort of amusing and fun. We really like other people who are kind. And we form the most meaningful, close relationships that actually turn around and benefit us the most by being pro-social. And that's, again, the gist of what the Greater Good Science Center is offering. And the reason I have two charts here is just because we're drawing from two different samples over 2 different years, and it suggests, again, the strength and validity of the data. Other ways that we measure happiness is by looking at expressive behavior and looking at activation of pathways in the brain that represent or signal feelings of enjoyment or pleasure or connection or affiliation. Typically, it's dopamine circuits, but often it can be circuits that speak in the language of oxytocin or serotonin, or even the endorphin system, which tends to quiet our own distress in the service of being able to help another person. A recent study, just to hone down into some of the health benefits of happiness, in this study from 2010, researchers interviewed individuals in Canada, in the Canadian healthcare system, and engaged their happiness by measuring kind of their expressions, their tone of voice, the kinds of things they talked about in this interview, and then related that index to their vulnerability or the incidence of coronary heart disease. And in this study, what they showed is that just 1 degree increase in happiness and rating of happiness makes people 22% less likely to experience coronary heart disease. So there are these really clear, measurable ways that happiness affords health. In a second study related in a related domain, happiness is associated with immune response. So in this case, we had the researchers evaluated the mood of a person on the day of a vaccination. So that would be baseline, and then, or actually on the day of vaccination, and gathered indices of immune response, and basically showed that at 4 weeks and 16 weeks post-vaccine, the individuals who were in a better mood, who were happier on the day of the vaccine, generated a healthier immune response to that vaccine. In another similar study, researchers actually exposed participants to a cold virus, and those participants who scored higher on measures of happiness were less likely to actually develop a cold, again suggesting that happiness affords a greater, a more effective immune response. Looking at, again, people's facial expressions, and this time young children, LuAnn and Elizabeth Dunn have shown that when kids are given the chance to share with a puppet, and all of these different conditions along the bottom are different variants of sharing. There's one that's highlighted in yellow, which is when the kid is sharing from their own little cup of goldfish crackers. In the other conditions, they're kind of fined a goldfish or they're given a goldfish to share. And the point is that when kids, young kids, these are 2-year-olds, are giving from their own supply, they smile most broadly and most authentically and most genuinely compared to other circumstances that you might imagine would bring people joy. And this, again, is to highlight the importance of generosity and the essence, the essential fundamental drive to be generous in bringing happiness. In this research study, a neuroscientist collaborated with neuroeconomists to understand this idea, because of course economists like to think that humans are totally rational and objective and will maximize gain to themselves because that is mathematically sensible. In fact, that's not what happens in the brain. When this team, including researcher Bill Harbaugh and his colleague Dr. Hubbard, looked at charitable behaviors over the course of multiple studies, what they find is that being charitable, contributing to the welfare of others, actually ends up activating neural circuits that are associated with reward and pleasure and reinforcement, which again means that we're driven, we're fundamentally motivated to give to others. And Jamil Zaki at Stanford, I love this quote, says that being kind to others registers in the brain is more like eating chocolate than like fulfilling an obligation to do what's right. And again, the chocolate is it's a source of pleasure. So can being kind to others be high on the list also. LuAnn and Elizabeth Dunn, again, looking around the world and connecting pro-social spending or charitable giving, the generousness of people in a particular geographic location, looking at how that relates to happiness, measures of happiness. And it turns out that with the exception of places that they didn't study, which are in gray, or places where there is terrific strife or threat or warfare or inadequate resources, which are in pink and red, everywhere else that they look, the relationship between generosity and happiness is a positive one. And so, again, humans have this fundamental drive to be generous. Why else is it helpful to be happy? Well, we live longer. We also have more satisfying relationships. And I'm going quickly through that live longer because I know that we're short on time. But there's many studies looking at happiness and in people over a period of 5 to 10 to 15 years, showing that people who score higher on happiness are just less likely to die over the course of those longitudinal projects. When we're happier, other people rate us as more likable, and that's what you're looking at in this rather dated study, but sort of foundational. If we see somebody who's smiling, we find them more likable. Their smile actually arouses a positive feeling in ourselves. We enjoy that. So being a happy person is an advantage to us socially. We're more effective in our work, and supervisors rate our work as more innovative and creative when we are a happy person, when we score high on happy measures of happiness. Recently, we just got a new iteration of the World Happiness Report, which has been coming out every year since 2012. And basically what this team of researchers, both economists and well-being researchers, has been showing time and time again is that happiness is as worthwhile to study as a metric of national success as the traditional measures that we might think of like GDP and literacy or mortality or health and well-being or effective social systems, because all those things are improved when happiness goes up. There is quite a long list of findings that offer specific strategies or techniques or practices that can be conducive of happiness. I've organized these here into two columns. One that is about contentment, and that is kind of your ability to be present in the moment that you're in. You can achieve this through the more kind of quote-unquote spiritual mindfulness kind of practices. Secular mindfulness practices are out there too, or even just breathing practices. And yoga traditions can be quite helpful in helping cultivate awareness of the moment that we're in and awareness of our mental habits that might actually not serve happiness. Being optimistic is a really helpful kind of habit of thought that contributes to happiness. Self-compassion is a rich and fascinating literature that points to the kind of opposite of self-criticism. And what we found is that when people are self-critical, they're just less likely to meet their objectives and reach their goals despite popular opinion. Experiences that offer levity, amusement, or awe in the face of, nature or beauty can be really powerful ways to ratchet up happiness. And then, of course, anything we can do to establish and strengthen resilience is of value to happiness, and particularly for healthcare providers who face more emotional labor than most in terms of their professional activities. And the second column is the strength and social connection objective. What can individuals do to build this, what we call trust, or Amy Edmondson calls psychological safety? Can we engage in activities or design our spaces to instill a sense of common humanity? Can we get better at just having small informal conversations with each other that help us get to know each other and understand where each other are coming from? There's an incredibly delightful space of science that explores gratitude and the extent to which gratefulness confers happiness, both individually and within relationships and communities. There's many ideas that help us build social support, from becoming more empathically attuned to exercising compassion, being willing to ask for help, and sort of honing our skills at reconciling conflict. A lot of Westerners in particular think that they are better off holding grudges than apologizing and forgiving, when in fact that's simply a myth. There's a ton of research, which we've touched upon already, about how generosity through kindness towards others is actually something that serves happiness. As an example of the fact that this can happen and that practices can work, I'm showing you some data again from our course. One of the practices that we encourage people to try in our course is called active listening, and it's a way of empathically tuning into what another person is saying without imagining what you're going to respond with or what else might be on your list of objectives for the day or the evening, but really just attuning to them completely. And what I'm showing you is that the rates at which people report having done them, and then also their perceptions of perceived change. And in terms of feelings of connection and empathy and overall happiness, the more people do this practice, the higher their ratings of change are. And that's your blue and purple chart on one side. And the other side, we ask, how does this practice affect other aspects of well-being, like your close relationships, the quality of your social interactions, your satisfaction at work or school, the effectiveness with which you feel like you can help others, and just your physical experience as a person. Are you in pain more often or less often? And again, the more people report doing this practice, the stronger impact they report this practice having on them. So again, at the Greater Good Science Center, we have a library of different practices pulled out of research studies that have shown that these kinds of activities can really build happiness. And so we offer this to anyone and everyone. We also teach a series of courses on the science of happiness at work, which draw from these practices. And just to kind of lighten the mood a little bit, these are some of my favorite little cartoons that I think relate to the experience of happiness or potential for happiness at work. The bottom right one about empathy is one of my favorites. I don't understand how that provider's pants really work, but in any case, empathy doesn't mean totally absorbing or taking on another person's emotion. At least the healthy kind of empathy that leads to compassion doesn't mean that. What we mean is sort of engaging that caregiving, nurturing spirit in the face of another person's suffering. So in closing, I just want to share a quote from Dan Gilbert, one of the foremost experts on happiness, and in particular the mistakes that we make in thinking about what will or won't make us happy. He says, if I wanted to predict your happiness and I could know one thing about you, it wouldn't be your gender, religion, health, or income. I'd want to know about your social network, about your friends, your family, the strength of the bonds with them. And that's really, again, what the Greater Good Science Center is here to offer people specific strategies for, is building those relationships, engaging your generous impulse, your innate kind of drive to be kind and cooperative and draw on others for support as a resource, and the extent to which these activities really build happiness. So I'll end with just a list of the resources that we offer out in the world for anyone and everyone to access if they want to know more and learn more. One thing that's not on this list that I really like is our Science of Happiness podcast. I was lucky enough to be a guest host yesterday with an award-winning poet, Ross Gay, who wrote a book called The Book of Delights, where he wrote for 1 year an essay every day about what was delightful. He's sort of a prodigy of happiness practice. So if you like to listen to a podcast while you exercise, they're wonderful little 20-minute episodes that describe different people's experiences with various happiness practices and experts who have studied those practices in their own research. Thank you again for your patience, your willingness to accommodate things not working out as expected, and I am happy to answer any questions.
Thank you, Emiliana. Hearing all of the research supporting the power of positive emotions really drives home the benefits of investing time and resources in the programs that we heard about in the first part of the call, and really appreciate everyone bearing with us and appreciate all of our speakers being with us today. We really hope that our audience leaves with some practical tips for improving their own happiness and also information and resources to create cultures of well-being back in their organizations. And we would like to ask everyone to take a moment to share feedback from this event by completing a brief survey, which can be found on the bottom of your screen. We'll also share a recording of the event in case you missed any of the presentations or would like to share any of them with your colleagues. We also hope you'll stay tuned for future webinars in this series, including our next webinar on April 11th on mental health. And thank you all again for joining us today.